Oh, sorry about that. Just checking I think my tripod's gone funny. Right, let's try again, shall we, with a live. I'm just going to put a little bit more lip gloss on whilst we're here. Now, Dr. Ellie, hopefully, will be here. It's very deja vu, isn't it? 9:30. Let's do this. Oh, my nails are about to fall off. I'm going to redo my nails. I bought some nails from Primark. I don't know. Should I do a live on putting my Primark nails on? They are £1. I mean, what's not to love about that? Right, let's have a look. Let's see what we're doing here. Okay, now do I request? I can't remember. Honestly, you think I'd never done this before, wouldn't you? Let's see. Go live with, is she there? No. Let's go live with Dr. I'm going to wait for her to request. No, I'm going to try it. Blimey O'Reilly. Look, this is, yes, darling. Hang on. Do they fit you? Stop. They look good, yes. They look good, don't they? Sorry, we've just got some new joggers. Love the bins. Oh, yay! Okay, you wear the night cardigan. Oh my God, hello.
I can't believe this.
I love talk me through this collar.
It's nice, right?
Is it a dress?
It is a dress. Let me give you a twirl.
Okay,
I just literally
I
1 minute.
literally am in a jumper and really old jeans.
No, but I felt after everything yesterday, I needed to dress up.
Oh my God, I love
Listen,
it.
I just literally few minutes before I came on, it just said no internet connection. I was just about to have I have heart attacks a few times a day. Yesterday specifically, I do apologize. I have no idea what happened.
Doesn't matter. It doesn't matter. It's done now. Do you know what? There are worse things that happen. It doesn't matter. How are you, my love?
How's your boy? How's your little boy?
He's fine. We're going after this. We're going to the hospital after this.
Oh,
so it's actually really good that we did it at 9:30, not 11, because I need to be at the hospital at 11:15. So perfect.
Okay. Well, you will be seen very quickly. These days, the hospitals are very quick.
Oh, they were amazing the other day. We've got an appointment at the fracture clinic. It'll be awesome. So how are you?
I'm very well. I'm so happy to see you. How are you? Are you ready for Christmas?
No. Don't be ridiculous. No. Don't be ridiculous. Sort of. More so than normal, but sort of. I still then forget things. But yes, no, it's fine, isn't it? I mean, I could sort of think, it's fine, actually. It's not a problem. It's all going to be good. It's all going to be good.
You seem quite relaxed.
Yeah, I am actually. I keep thinking about things I need to do. And someone said to me yesterday, it's 15 days for Christmas. And I was like, yeah, funny. She's like, no, it is. I was like, no. That suddenly seems really near. It's fine.
It's fine.
So we have had so many questions about skin boosters and fillers. And then people also want to bring in and understand the difference between fillers and Botox. So let's get through as many as we can. So starting with, I've got my little book here, although I managed to move my pen. Can we talk through what are skin boosters?
Okay, so I have a really silly analogy for that. Okay, so imagine spaghetti strings.
Yeah.
I've been practicing this, so I can actually make it quite simple, but it's actually a good one. So imagine spaghetti strings, and so when you overcook your spaghetti, you know how it kind of gets all stuck together, it becomes quite hard. So that's fillers. So it goes in there and it volumizes or lifts because it's harder and it's kind of stuck together.
I'm just gonna lie to you. You're not selling me with the spaghetti in my face, but I know that they work. Okay, sorry.
So I'm comparing it to skin boosters. Skin boosters, right. Imagine the spaghetti strings, but not overcooked. They're a little bit like, jelly, and they go everywhere.
Yes.
Okay. They're not actually going to lift anything. They're not going to volumize anything, but they just kind of glides in under your skin, and depending what we want it to do, it nurture your skin. It does get rid of perhaps fine lines, it make it glow, and whatever purpose we want, but it's not like that lifting or volumizing the face. So
it's just a little tiny plumping. Is it like the most like giving you skin that you had 5 years ago?
I mean, it depends what I love how they work sometimes when you have this kind of, people come to me and they complain about the jowls, and they're not necessarily having the jowls, but they have this kind of crease here that we get. Yes,
Are
it's a
these
bit like a
marionette lines?
correct, or resting bitch face. You know, when you have this kind of droopy, I quite like to use the skin boosters for this area. Well, you're doing that.
And I do that, because if I just sit normally, hey, look, it is.
Yes, it goes down a little bit. Yes, that's right. But sometimes having fillers here, it actually makes you look quite masculine and big, because this is kind of a delicate area. Anywhere in the face is a little bit more, you can hide it. Here you can't hide it as much. So you can look, what are those puppies that you have that they talk? What do you call them?
Like a ventriloquist.
Yes, that's right. So you can actually have that look when people kind of insist of having fillers here. I don't like it. I think if you can get away with skin boosters,
Yes,
you can
because
actually, you don't plump anything, you don't lift your face, but if you are softening these lines, voila, good to go.
now, one of the things that I want to know, and actually other people did ask, so, and yesterday I did very briefly touch on, but I didn't save it, in my really rudimentary
You
level of
did
knowledge.
so good yesterday. I was literally crying and watching you, and I'm going, I should be there.
So because fillers are essentially, I know people that, I mean, don't get me wrong, I've been seeing you now for 5 years, and you've always said, fillers, fillers, and I've gone, no, 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 no. And then last year I said, okay, let's do it. And it was because I didn't realize, I think fillers are really scary things, because everybody says, oh yeah, everyone with fillers looks rubbish. And I've worked out, correct me if I'm wrong, the point is, if you have really good fillers, you won't ever know. Nobody will ever know. So the only fillers that you see and that you notice are bad fillers.
Correct.
And
I mean, it's so, you just put it there really, really well. Bad fillers, you see them. If there
that's
are
what gives them a bad
placed,
rep.
yes, absolutely. If they are placed in a wrong layer of your face, if they are placed superficially, if you have products that doesn't go with that part of the face, if you don't have a competent injector, yes, there are, so bad fillers are the one that you see them. I think also, I had a really good question the other day. Somebody said to me, how do you know, where do you get to the point when you shouldn't have any more? And I think it's really, it's very much down to your injector to say, actually, you're good now.
When you're Nicole
You're good.
Kidman and you can't literally, you can't move
Is
anything
it,
in your face.
oh, is that the new series on Netflix? I
The
haven't
Undoing.
seen it.
I mean, she literally, her face did not move. It was like she
Yeah.
was at the end, the really emotional bit. And it's like, Nicole, acting, love. The face just did not move.
But you
Nothing
look at
moved.
Hugh Grant, and he has had no work done, and it just goes to shows how much pressure is on us women to look great.
Yeah.
So
What's in fillers? That's what I wanted to get the difference between what's in fillers and what's in skin boost. So fillers are actually hyaluronic acid, aren't they?
very much so, yes, and tons of it. And this is the thing, when you have hyaluronic acid in your own body and you have fillers, so it can actually really promotes the skin. And it actually, imagine when you have a little bit in your cheeks to just give you a little bit of lift. And if you have that kind of a lot of volume loss, and for you specifically, because you run, don't you?
No, I don't anymore. I
Not
walk
anymore.
now. I've stopped.
Yeah,
Do you know
walking is
what? I
the
have to
same.
say, I have stopped running, and actually, I think it's. I don't. I think you can. I think you can see it in my face that I don't run because it was so
There was a time
sagging.
when there was a time when you you became quite
Yeah.
lean in
Oh,
your
yeah.
face, and this kind of sagged a little bit. So when you inject very deep, not just to give you a lift, but it's also kind of differentiate between your upper face and lower face, and just give you a little bit of contouring. Otherwise, you're a bit like pancake. You know, when you just flat.
Yeah.
And you
When
have
I
that
can
kind of
basically,
sag.
when I can tuck it into my bra, I think that's what we were at. I was literally about to be able to literally just take it all in the boobs.
You're exaggerating, but you know,
Nearly.
a little bit, and it makes your skin, because hyaluronic acid underneath, it actually makes your skin looks much, much healthier. So yes, in moderation, and put in a right place in the face, and a very soft, delicate product, you can look amazing, and nobody would know.
So what's the difference? What are in skin boosters?
So in skin boosters, for example, most of the skin boosters, for example, Profilo,
Yes.
or Hydromax, these are a course of treatment. So most of them, how it works is that you have 2 or 3 with 3 weeks in between, because what it does, it actually works for you. So you put it in your dermis or subdermis or different layers of the skin, and you leave it to do what it does best. So Hydromax, for example, it has sorbitol, and sorbitol it works wonders. So it kind of plums, and it makes, you know, get rid of fine lines. You remember the spaghetti that I told you? It kind of glides everywhere. So after 3 weeks, you have another injection. And then sometimes for neck area or chest area, which is bigger and larger, you have another one. So maybe 2 to 3 sessions. So skin boosters, it tends to be in stages. So 2 to 3, it's 3 sittings. Where fillers sometimes,
Yeah. Is that so that you can see if it's worked? You can say, okay, fine, you need a little bit more here.
And then you can just add on. Yes, that's right. Yes. I mean, anything to do with skin, Kat, it needs commitment. It needs, you need to, you know, it's not a kind of a magic wand. But I love those for lower face, for my red lines. I love them for hands. And I think sometimes they can look much nicer than fillers. I think if you are really opposed to the idea of fillers, it can actually do wonders for your face. It's not going to, if you've never had anything done before, obviously we have to manage expectations, but it can look absolutely gorgeous. Another thing that I was going to, yes, carry on. You carry on.
No, I was going to say, because just the questions. So the best thing, what would you recommend if people said, you know, they've got the jowls, the jowls or something? What would you recommend for people to get back their jawline? Is that, you know, what would you recommend?
Depends how far it has, you know, if it's quite, you have quite a lot of sagginess here. I tend to be quite transparent and honest, and I'm like, you know what, maybe you come to me for the jowls, but I would say there is really not much that can be done about it unless, you know, you want to go on surgically, have anything done. But most people don't want to have them. But my thing is, we can improve something else that actually distract you from the jowls. For example, we can put a little bit of skin boosters in your lips. You know, that makes you feel amazing. Look in a mirror, or we can actually maybe add a little bit to your cheeks. So when you look in a mirror and you look and you feel, actually, I look good, I like what I see, it takes the tension away from the jowls. I might not be able to do anything about the jowls, but I can make something else beautiful and make you feel good. It's all about how it makes you feel when you look in a mirror.
Now, just mention about lips. I mean, I am immensely reticent about having anything done to my lips, because I think, again, is it like the fillers? Is it, and somebody's mentioned up there that everybody looks like their wind tunnel. No, the only people that look like they're in the wind tunnel are people that have had too much. There are people walking around every day, you think they look really good. They might have had stuff, they might not, but people that have had it done really well, you won't know. So maybe the lip thing is you only notice people who've had it done badly.
You'd be surprised for the last couple of years how, I wouldn't have said this to you 5 years ago, but you will be surprised how many, we have moved away from the big lips, from volume, because now we have the products and the technology that we can put in lips that actually makes them just hydrated. And for them just to look, you've got a little bit of lipstick, a little bit of lip gloss. It doesn't volumize, it doesn't, it just nurture them. And people love that. It's like having new perky boobs, you know, it really makes you feel sexy. So you'd be surprised how many lips we do of actually mature older women. You know,
look, seriously, somebody said, I've had lip filler with Juvederm and I've had the smallest amount and they look really natural, no trout pouch. And do they get rid of the fine lines here?
Yes, it can do. It can do. If you come in for these smokers lines, having those a little bit hydration in your lips and revive them, even these won't actually be as noticeable. I tend to, and this is another area that I insist of not using fillers, is the smoker's line. I don't like that because you get that bumpy monkey look. I use skin boosters for smoker's line and it looks incredible, incredible. But please don't be opposed to the idea of, I mean, I even sometimes as a gateway put a little bit of skin boosters in the lips. It won't last as long as fillers, but it lasts perhaps between 4 to 6 months. But it's so soft, it's so delicate, and it just gives you an idea what it will be. And then we can just upgrade to a very soft, delicate fillers. But lip fillers can look incredible and it makes you feel so sexy.
Okay. People have been asking, I've never heard of this, about thread lifts.
I'm not a big fan.
What are they? Because I'm sure that many people don't know what they are.
So thread lifts are, it's supposed to be lifting you and giving you, lifting the jowls and giving you a brow lift. I don't use them. I'm not a big fan. I think the result is not long lasting and sometimes even very minimum, and they're quite expensive. And I think it's just, it's disappointment. I mean, I don't want to, I know a lot of my colleagues use it and I know a lot that don't, but it's not something that I don't know.
Someone's just asked, do they pull the skin back? Is it like an old?
They do. But I think what people's expectation is going to be like surgery, but it's not. Yes, you basically put stitches here and lift it up. It's painful. The downtime is horrific, and for not that much. If you are in your late 30s, mid 30s, maybe, but for more mature women, what they want
in their late 30s, they should be having, no, really?
Yeah, exactly. But they do. But for us that will have a grade of jowling and a grade of sagging, or even more mature women, I no, it's not great.
Right. Somebody said, what about gold threads? What are they?
Gold threads?
A Christmas facelift? No. What are gold threads?
Because I don't do threads, I'm not really following the latest trend and stuff. But
the latest
I'm
trend.
happy if you DM me. I'm happy to do my research and answer you. I'm not into threads.
But you would say there are alternative things that people can have done to do, instead. I mean, it sounds quite drastic to me. It sounds quite not old fashioned, but it sounds sort of like something that people did years ago. Whereas now, because I've been to a conference. I went to a conference on fillers.
I think in my
conference
practice,
on fillers, which is why I know about it.
Did you?
Yeah, I went. Yeah, it was Juvederm. I went to a conference, and it was so fascinating. I went with Rylan, and I went with Rylan and Dr Ellie, and it was absolutely fascinating.
You must have gone to Allergan. Was it Allergan?
Yes.
I mean, I don't work with Juvederm. But it's the same concept. Yes. Yeah. Oh, I'm glad you found it interesting. We call threads Satan's poops.
Love it. They do, but they managed to completely change the contour of people's faces. And he did one live. This guy, I think he's Brazilian.
You went to see? Oh, he's
amazing.
Not Marco.
You could say all the names. I can't remember.
My God, I know. Is it Massimo? Oh, I don't know.
Anyway,
yes, I know what you mean. Incredible. Yes, he's incredible to watch.
That's when I thought, oh, hang on, this sounds quite thing. And I've had, so we should tell people actually, I always say this. We did fillers last year, and I know it was a year ago, as I said yesterday, because I had it done on the day of the British Fashion
Awards ceremony. That was heart attack.
But I didn't bruise. People have asked about bruising. I didn't bruise at all.
No,
but
I
do
mean,
some
there
people?
is an element of, you have to allow some downtime. You can, your face is full of veins, and I mean, you have to allow. I would be, my job would be so easy if there was no bruising involved.
Yeah.
Cheeks tend to be maybe perhaps a little bit, but it's, you can easily cover those with makeup. It's not, you know. And lips, I tend not to, again, I use very small needles. I use Botox needles actually for lips, so they tend not to bruise. But you always have to allow a little bit of downtime.
Right. Somebody has just asked, is Profilo, did you say Profilo or Profilo? Profilo?
Profilo, yeah,
Profilo class as skin booster? Yes, you said it
yes,
was, didn't you? Brilliant.
yeah, the
Now, let's
spaghetti.
spaghetti, yes. Somebody has asked, a couple of people have asked actually, and I did have messages about it. And I know we didn't, it wasn't something we were going to do, but I know you are a massive fan, and I know people, a friend of mine has been to you and is over the moon with the what do you call them?
Teardrop.
Something
That is
fillers.
my absolute favorite treatment. I adore that treatment because, you know, we have had all children, we have had sleepless nights, we have been, you know, up and down, and, you know, we've been dieting, we've been losing weight, getting pregnant, you know, going through divorces, griefs, all of sort. It does take tolls on his face, okay? And I actually see that as a clinical treatment rather than beauty, because I think, you know, no matter what, you trying to hide these bags or panda
Does
eyes
it
with
work for bags?
concealer.
Yeah.
Well, if you have, you have to assess that. Not everybody's candidate for it, but if you
Okay.
have, it's a wonderful treatment because it lasts. You get a lot for your money. It lasts quite a while. You know, mine has
That's what somebody
lasted
said.
nearly 2 years. But I don't use needles, so there is no bruising involved. So you don't have to
What
risk,
do you
you know,
use?
having. I use cannula, and so it's a little bit of magic, and it doesn't hurt. And I know it sounds scary because it's around the eyes, but actually quite non-invasive compared to other treatment. It doesn't hurt, doesn't bruise, and it's just wonderful because it really is like a forever concealer under your eye. It is smooth. It brightens the pigmentation. It is literally gorgeous. We have to, yes, in
I should have
fact.
it. Well, I've been stressed this week with my little boy, so you know, there's
And
loads of
also,
people that
there's
had
the
teardrop
most
fillers with you.
wonderful, the most wonderful thing, Kat, is that, you know, most of us, our age, we will not be seen without makeup. And this actually makes you look so fresh that you, for the first time ever, you look in the mirror, you go, actually, I can do the school run without makeup because look how amazing under my eye looks. I'm telling you.
Do you know what? Someone said a really good point here, and you said a really good point earlier, actually. And I think this is something that I know people. The thing about having anything, going to see an esthetician and having anything done to your face. Some people are like, don't know where you were, don't know what to do it. Whereas other people, I know, look in the mirror and they don't like what they see because it's so different to how they used to look. And I think there's a massive difference between somebody changing the way they look. So suddenly going, I want big lips, or I want big, rather than going, I just want back what, you know, to be more similar to what I had. I'm not ready to completely, you know, give over to, I mean, we should all be incredibly grateful that we are able to age, of course. But Ellie's frozen. Frozen. Ellie, come back. Come back, come back.
Kat.
First of all, there are a couple of morons here I'm going to get rid of. Just get rid of them. Are you back?
Hello?
But anyway, I'll carry on. Hopefully she can hear me. Hello? Hello?
Hello?
She's back. She just moved. Hello? Hello?
I can hear you. Oh,
So,
you're back. Yeah.
Do you think? So I was just saying that I really think that for some people, so if you look in the mirror, like you say, and it is your teardrop that you look and go, do you know what? I can't bear that. Is it best that some people just to start with perhaps focus on that one area that, you know, for me, it's this. I'm not bothered about my forehead particularly. I'm not bothered about, I don't think I've got, I think it's down to creams actually. Fine lines here, not that bothered. But here, this here, I sometimes, you know, resting bitch face is exactly that. I just feel that this is, I do look like the old
I think
saggy
when you
dog.
become, this is, I strongly believe this, when you become quite flat in your cheeks and you have that kind of pancakes look and there is no definition, you see these even more. So sometimes if I can't do much about this, if you are lifting and
Yeah.
supporting the cheek and differentiate the cheek, you actually won't notice anymore. It might not be able to lift the jowls, but it definitely lifts your nose to mouth lift. And also the light hits your face differently and you just look amazing. It's about when you look in a mirror, what do you see? If you have
Yeah.
nothing and if you have this kind of saggy face, then you can see all of the flaws. But you just improve one thing, like you said, one thing, you improve one thing. You'll be surprised how much it makes a huge difference in how you feel psychologically, how you
Yeah.
feel when you put your makeup on, just one thing, even if it's a little bit of skin boosters in your lips or a little bit of, it doesn't have to be Botox. It doesn't have to be taking the lines. It just have to be a little bit of zhuzh. Voila.
And what would you say? What would you say if people said, would you recommend Botox fillers over Botox? Has Botox had its day? The things that fillers can do now, actually they can do loads of things that Botox used to do. It lasts longer.
I agree. I think when it comes to a
Is that the
certain,
case? Yeah.
I think when you come to a certain age, I think Botox is just a helping hand. It's not actually going to do wonders. If you've never ever had anything done before, perhaps is a very simple, easy treatment to begin with. But if it's done very softly, some people would like call it baby Botox, which is just means little, very little. Not necessarily put any in the forehead, a little bit here, tiny bit in your crow's feet to soften things. It's easy, but it's not going to take you back 10 years. I
Yeah.
think people are
But
more and more open to the idea of fillers. I know there is a taboo and there is a stigma attached to it, but you put it down beautifully. Those are just bad fillers that you can see. If it's done
yes.
nicely, yeah.
Yeah. People do, but I mean, I will tell anybody that I've had it done, because as much as I work with lots of skincare brands, I work with, things, I would hate someone to think that, all this is just down to cream, because it's not. Don't get me wrong. The texture of my skin, the tone of my skin, that is all down to, but the actual structure, the structure of my face, creams can't do that. I mean, I
No, and
do
I
think
think,
fine
yeah.
lines, they do work for.
And I
I
think
genuinely think.
I think we can get all the help. I think this is what I love about you. I don't know anybody who hasn't had fillers. I don't know anybody who hasn't had Botox, and I know a lot of people deny it, and that's fine. That's. But I think there is absolutely no shame in that. Is my opinion, and I think you're so open about it. And you see me once or twice a year. That's not even
Well,
that.
normally it used to be when I did the Botox, it was probably twice a year. But I haven't seen you for a whole year. And
Yeah.
actually, I mean, I am going to see. Well, I'll come after Christmas. But actually, I don't feel that that. Oh my God, my face is literally. Again, I can tuck it into my bra. I'm really actually happy with it. I think and I know someone will then say, "Why are you going?" Just to keep on top of it. Just to, yeah.
And I think it's down to your injector to say, actually, no more. You're great.
Yeah.
I have so many people coming to me. What can I have? I'm like, a cup of tea. You don't
Yeah.
really need anything. You
Yeah.
just, skincare, or
Yeah.
skin boosters. Maybe have a profiler, because that's, use it as a
Yeah.
facial. Instead of having perhaps expensive facials, profiler will do. I have heard that, I mean, Victoria Beckham, she had profiler every 6 weeks and she used it as a facial. And I think
How long
perhaps
does it last? How long for
six,
normal people?
if you have profiler quite frequently, I have a lot of patients coming to me and they have it done frequently as a facial every 8 weeks, maybe every 3 months. Yes, it's amazing, but it's just a very intense and amazing facial. It doesn't volumize, it doesn't lift, but it just
Yeah.
moisturizes your skin, and you just have that wonderful glow. And it
Okay, so
lasts
that's the
about
final.
6 months. Fillers last
So it
a lot
lasts, so you
longer.
could come twice a year. You could come and have it twice a year, and you would, yeah. For normal
Yes,
normal
and it
people.
works really well as a complement other treatment. If you have a little bit in your cheeks, then it works even better. Profilo and other skin boosters, you have to consult your injector, and they have to be quite candidate for it. Not
Yeah.
everybody will see results. So
Okay.
it's important. Yeah.
What somebody said, so somebody, can we just go again? What are skin boosters? Obviously we know what's in skin boosters. Is it what, well, no, I
In
remember, isn't it?
Profilo, it's hydroxyl acid, and obviously that with your own hydroxyl acid in your body is tons and
Hyaluronic.
tons. Yes,
Yeah.
it's tons of it. So it will make it glow. It will make you,
Okay, so it's
it will hydrate your skin. There are other skin boosters. There are plenty of other skin boosters. What my favorite is Hydromax, which is tons of sorbitol in it. And sorbitol in your skin, again, it works a little bit differently from Profilo. So it depends. Some people use Juvederm. Juvederm has a range of skin boosters, which is
yes.
injectable. Yes. So what works for you? That for me, yeah.
Brilliant. Somebody's asking, and we do it because lots of people have them. I said, what about the deep 11s?
Yes.
What would you do for the deep 11s?
I mean, depends how deep they are. I would start with Botox, and I think Botox works very well. But Botox, you have to be committed. If you are having a really deep 11
Yeah.
and you are a big frowner and you keep frowning for a long period of time, you have to not to be able to frown, which means you just have to be committed to your Botox every 3 months, every 4 months, perhaps 3 to 4 times a
So
year.
someone would
I
have to
know.
basically take my kids away. Just take my kids away and I'll be good. Joking.
Well, not to frown, is that what you're saying?
Yeah, not to frown. Yeah.
Yeah.
Yeah. And my
I
husband.
mean, yes, exactly. I mean, this is if they are quite deep, then you just have to be committed to that 3 times a year.
Okay,
If they
okay.
are super, 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 super deep, then you have to kind of understand that perhaps they will always be there.
They might be something, yeah, definitely. And what about the forehead? Because this is something I know that people, I mean, we've spoken about this loads, haven't we? And this is, I know some people said, well, I had Botox and it made my eyes go saggy. And that is because, isn't it? It's, again, that's, correct me if I'm wrong, but that's down to
Uh,
your aesthetician, because
I'm
it
not a
does.
big fan of having Botox in your forehead. I find it unnecessary. I find it silly. You know, you have to have movements there. These lines, fine. We're all going to have them. We are in our 40s, 50s, and 60s. So trying to hide these, I know people are quite aware of them, is just going to sag you. You will not have a nice lift, and it's not a great look. So perhaps leave these and concentrate on having a lift and having a little bit of other areas that
Because
is
you
going to.
want to have some, you need to have some lines. And it, if this is, I mean, I do know people who have literally, like a completely thingy forehead, but then they've got a really veiny neck. So, or you look at their hands, or,
Yeah.
I think you do, you do need to leave some of the aging process there.
And I absolutely, and I think that's when you start looking not natural. It's when
Yeah.
you trying to trace the wrinkles and trying to chase the lines, and we will have lines, we will have wrinkles, and it's something that actually, if you have amazing skincare, medical grade skincare, and if you use amazing
Yeah.
fillers, lines, it doesn't age you. I've said it so many times. It doesn't age you.
Yeah.
Actually, you can look. If you look at Jennifer Aniston, if you look at her with sometimes when she has lighter makeup, her forehead it's so liney, but she's probably have a lot of skin boosters and a
But
tiny
she
little
looks
bit of fillers.
incredible.
Exactly. But if she was going to do a Nicole Kidman and trying to get fight the lines, then that's when, as she will look really fake. I
Yeah.
I I think you have to be open to. You have to accept a certain amount of aging. We are going to
Well,
age.
I think it's more, do you know what? And also, who wants to have A, that maintenance, B, you're right, it doesn't look natural or real, and C, I mean, I want to be able, I want to look my age. I don't mind looking my age, but I want to look, it's a very vain thing to say, I'll say it, but I want to look good,
And this beauty industry and aesthetic industry is a £1 billion industry. You will always have an injector to say, oh yes, that's good, absolutely, let's do fillers, let's do this, let's do that. And I think And I think there will be always somebody that are willing to sell you something for £1,000 or £2,000 to give you to give you the promise of, but like you say, what is that? How much are you going to be doing that?
Yeah.
How often? It's crazy, you know? So I say, look, in your 40s, in your 50s, you are going to have jowls. You are going to have forehead lines. You are this is, but there are other things that you can actually make you feel much, much better. So accept those, don't chase them. And yeah.
But I do think a really good skin routine can make a massive difference on top. You can't do one without the other. You know, that's like doing, you know, loads of exercise, but not ever exfoliating your skin. You know, it doesn't work like that. So I think the difference that you can get from having luminosity in your skin, from having radiance, all these other things on top of a good structure.
It can make you look, it can make a huge difference, huge difference. I think even fine lines, and you know, people get, I think when you have, for example, active ingredients or medical grade skincare, it actually, you know, sometimes you start peeling and all the old skin goes, you know, you look in a mirror, you're like, holy shit, my skin was quite dull, and look at me now. Anything with us, especially after all these pandemic palavers, when so many things was cancelled, I think women are more than desperate for self-care, because we've had the kids at home, we've had the husbands at home, we've had to deal with the Zoom meetings, look at ourselves day in and day out. And I think a lot of us have actually lost a lot of confidence. I mean, I after the first lockdown, I was, you know, my mental health was really affected. You know what my Wi-Fi is like, and having the homeschooling.
God bless you. Oh, I've just got to get these in quickly because I'm conscious of the time. What medical skincare do you recommend?
I'm a hardcore Obagi fan, and I love it. And it says what it says on the tin. I adore it. I know my limitation. I'm not a dermatologist, so if there's something that I feel that I can refer to my colleagues, but in terms of not just basic skincare, but what it does, plasmas, pigmentation, rosacea, and just feeling good, just feeling glowing, it works. So that's my thing.
I think skincare is such a personal thing. Someone said they use Dr. Sam's skincare, which again I love. I mean, there are so many.
What's your favorite?
My favorite. Do you know what? It depends actually. I find I've got so many, and I've used different things at different times. So at the minute, I've got lots of different ones. Loads. That's a whole different one. Now, the last thing we're going to talk about is the Dr. Gross skin peel pads. I haven't got the Dr. Gross. I have got the Dennis Gross ones. Amazing. They are amazing. But I've got other skin anyway, retinol. But anyway, they're amazing. Sorry.
Yes, retinol and tretinoin. Those are active ingredients. Yes, perfect.
Amazing.
Stick with those. Yeah.
Amazing. What was I going to say? I was going to say, yes, price. It's just completely dependent, isn't it, on what someone has, on how much they have.
I say one thing, rule of thumb, please remember this, okay? You don't need to be expensive for the sake of it. Yes, there are practices or clinics in Harley Street that, you know, it's more like brands or people. But I'm telling you this, and this is, if it's cheap, it's not great, because there is so many offers there that are, you know, you have 3 mil for 6 mil for £300, etc. You know, please don't fall for cheap deals, because it's a gamble, and you really are risking huge, you know, the amount of people come to my clinic, and we have to dissolve the cheap deals. So really, I think be careful with deals and offers. I think that's to me, it's a red flag.
Yeah. Okay. So, but if somebody emailed you or messaged you, you could give them a rough idea of cost, couldn't you?
Yes. I mean, we have a price list, definitely.
Perfect.
Yes.
Yeah. Perfect. That's it.
Yeah.
Marvelous.
For sure.
Right.
For sure.
Well, that was amazing. Yay! We did it. Right. I've now got to go to the hospital.
Okay.
So thank you very, very much for that.
My pleasure. My pleasure.
It was amazing. And I will see you very, very soon on the other side.
On the other side. Happy Christmas, Kat. Love you lots.
You
Bye-bye,
too, darling.
darling.
Take care. Love your
Bye.
family. Bye, 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 bye.
Thank you. Bye-bye.